I'm Dr. Steve Magill. I'm a endocrinologist that works for Froedtert and the Medical College of Wisconsin. I'm originally from North Dakota. I grew up on a farm. I went to undergraduate training at the University of North Dakota, and then I did a PhD in physiology in North Dakota. Then I went on to medical school there, and after that my family and I moved to Madison, where I did internal medicine training for 3 years. Then finally we moved to Ann Arbor for fellowship training in endocrinology, and then I came back to the Milwaukee area after that, and we've been in the Milwaukee area since then. I'm a clinical endocrinologist. I have interest in all forms of diabetes, diabetes during pregnancy, hypertension, especially endocrine hypertension, including primary aldosteronism, pheochromocytoma, adrenal tumors. And getting back to diabetes, we treat a lot of patients with insulin pumps. I have a fair amount of expertise in pumps, starting pumps, adjusting pumps. And now we're using glucose sensors to help with the blood sugar control. One of the things that we always talk about with the patient is that we have a team-centered or a team approach to treatment of diabetes in particular. So I work with nurses and physician assistants, nurse practitioners, and we're all collaborating to help improve care for our patients. And of course, the patient is the center of that. So that's a big thing. We want the patient involved, and I think the patient will do better in the long term. Additionally, I have some research interests. One of the big areas I'm interested in is primary aldosteronism, and our group actually is involved in an international study looking at patients who have been screened and diagnosed with primary aldosteronism, and we're looking at those who have undergone adrenal vein sampling, which is an invasive procedure to help differentiate this type of hypertension, and it's very interesting research.